Welcome to NTMC Childbirth class. My name is Laura and I am a labor nurse. Through this class, I want to introduce you to our facility and explain what happens during the labor process. As you may know, anytime a group of mothers get together, they may share their birth stories. At NTMC, we want you to have a large part in writing your story, so we want to educate you on how labor and birth works. First of all, I want to welcome you and thank you for choosing our hospital. A little bit about us. NTMC is a 5-star facility given to us by the Centers for Medicaid and Medicare Services. We are one of 2 hospitals our size in the state of Texas to be awarded this honor, and we are proud of how we take care of our patients. We are glad you've decided to deliver your baby here, and we look forward to giving you our best care. Recognizing labor can help you decide when to come to the hospital. Real labor does not go away, and contractions get more intense and closer together. If your labor pains make you put your phone down, it may be time to pack your bags. If you're able to tolerate your irregular contractions, it's best to stay at home as long as you can. Being able to move and snack freely will make your labor a more positive experience and may even shorten your labor time. This is how we measure your contractions. In early labor, contractions will be several minutes apart. As labor progresses, these contractions get closer together. Start your timer at the beginning of one contraction and time how many minutes until the beginning of your next contraction. This is your contraction frequency. As labor progresses, the contractions get closer together. We do not measure the resting period between the contractions. When your contractions are 3 to 5 minutes apart and hurting, it's time to come in and be evaluated. When you arrive at the hospital, come to the Women's Center entrance on the north side of the hospital. This is just past the NTMC Women's Clinic. In order to protect our newborns, we are a locked unit. Please ring the doorbell at the foyer one time and someone will come and let you in. You will stop at the nurse's station so we can get you registered. Don't forget your ID and your insurance cards. After that, we will show you to a labor room where you will get a urine specimen, change into a gown, and get settled in bed. We will place monitors on you so we can hear your baby's heartbeat and time your contractions. We will then get you to sign consents for treatment and ask some medical history questions. We will start an IV and send blood work to the lab. Finally, we will do a cervical exam so we can report to your provider and make a plan of care tailored to you. At any time you have questions, please ask. This is your birth story, and we want you to be informed. Here is a list of things to consider packing for your hospital stay. We do have many of these personal items available for you, so if you forget something, just ask. If you need to hit pause to take notes, go ahead. I'll wait for you. We are a family-friendly facility. We understand that babies come on their own schedule, so you may have visitors whenever you wish, as long as it's not disruptive to other patients. We will not weigh your baby until after the golden hour or 2. Newborn feeding, bottle or breast, takes priority over guests getting to hold this newborn. While visitors are welcome at any time our patient is awake, we do only allow one support person to spend the night. For vaginal deliveries, you should be able to return home after the baby's testing at 24 hours of age. So consider having your visitors meet you at home the next day and saving the first day for bonding baby and parents. It is not uncommon to schedule labor induction at 39 weeks. The pros and cons of this can be discussed with your provider. Whether you are induced or come in natural labor and we augment you, these are terms you may hear. When your body isn't ready to labor naturally, we encourage it by introducing prostaglandins that will make the cervix favorable for labor. Cervidil and Cytotec are the same medications but are administered differently. Cervidil is a thin wafer woven into a string similar to a tampon. The wafer is placed next to the cervix by the nurse, and the string is tucked into the vagina for ease in removal. The Cervidil stays in for 12 hours before removal. Cytotec is a small pill that you will swallow. Cytotec is repeated every 4 hours for 1 to 4 doses. At the end of each dose, your nurse may check your cervix to monitor change. Once the cervix is thin or soft enough, you may start Pitocin. Pitocin is the synthetic form of the hormone oxytocin. Oxytocin is the labor hormone and stimulates uterine contractions and milk production. We often give Pitocin to strengthen contractions and make them more effective. As labor progresses and contractions get more intense, your membranes may rupture on their own. You may know this as your water breaking. This may accelerate your labor, and the artificial rupture of membranes can be a part of your plan of care if you and your provider agree. When laboring, these three things have to happen. The cervix starts out as thick and firm. As you get closer to your delivery date, the cervix will start to soften and then thin. As your cervix thins, it will start to open and the baby's head will start moving down. This image is a great explanation of how labor works. The fetal head needs to be engaged against the cervix for the cervix to open. The pressure of the baby's head against the cervix will stimulate the brain to release more oxytocin, which will cause the uterus to contract, which pushes the baby's head against the cervix. It's the circle of labor. This image shows the cervix effacing and dilating. As you can see in the first image, the cervix is long. As the baby starts moving down, the cervical length shortens and then starts dilating. In the last image, the cervix has dilated fully and the baby is ready to move out of the uterus. Fetal station doesn't necessarily follow any rules. Sometimes the patients come in and the baby is already very low. On women that have had children before, the baby tends to stay high until the cervix is all the way open, and then the baby starts dropping down. We typically don't start pushing until the baby is past the middle of your pelvis or lower. Contractions will move the baby down naturally, and we want to save our birthing person's energy for the big finale. These next three slides show labor progression. The first one is early labor. This stage of labor may be more comfortable spent at home. At home, you can eat what you want, take a warm bath, and stay off the monitors. At home, you can take walks and remain active, which can shorten your labor. This first stage can last several days. Active labor is between 5 and 7 centimeters. You may be able to stay at home for the beginning of this stage that may last about 3 hours. This is the time you may get an epidural if you choose. This is also a great time for your nurse to do some physiological labor positioning with you. Transition is the last part of the first stage of labor. It can go quickly and it can be intense. Contractions are very close together and there may or may not be much of a break in between. You may feel the urge to push or pressure in your rectum. It's important to not push until your labor nurse tells you that the cervix is fully dilated. Physiological labor is my favorite part of labor. By understanding how the baby moves down in your pelvis, we can assist you in having a more positive experience, shortened labor, and decreased pushing time. As in any labor, this is your birth story, and you have autonomy in your care. If we put you in a position that you're not comfortable in, speak up. We have a sheet of position images we can show you, and you can select from the menu. Physiological labor means that we use motion and positions to help you move the baby down and out. We use birthing balls and peanut balls to do this. While you're able to get out of the bed, you can benefit from straddling a birthing ball and moving your hips back and forth, or standing next to the bed swaying. Once you get your epidural, if you choose to have one, we will reposition you frequently using the balls to position your legs in ways that create more room in the pelvis. Positioning during labor has many benefits, and we like to take advantage of them. We won't just ask you to lie in bed and wait for your baby to come. After all, this is labor. We will work with you for the best birthing experience, and we want you and your support person to be actively engaged in your care. There are several options for pain management during labor. IV pain medications can be very effective for pain management because they work quickly. IV pain meds are typically opioids and can affect the baby. So for this reason, we do not give them close to delivery because these medications make the baby too sleepy. When IV pain meds wear off, the patient can often feel worse because the body has stopped producing endorphins, which are the body's natural way to tolerate pain. Epidurals are a very common pain management method. They work fairly quickly. They last as long as labor lasts because the medication is delivered at a constant rate. And epidurals can allow the birthing person to relax and enjoy the experience more. The best thing about epidurals is that they do not affect the baby. Spinals are used in scheduled cesarean sections. If you have been laboring with an epidural and for some reason you have to go to C-section, your anesthesia provider will use the epidural to administer medications for your surgery. General anesthesia is only used for emergency cesarean sections and for the rare occasion that pain coverage is not acquired through other means. This slide shows how the patient is positioned for epidural. The birthing person will sit on the bed with your legs spread wide and the body curled up around the baby. It may help to hug a pillow in front of you. The back is curved like an angry cat, so the spinal spaces open up and allow easy passage of the spinal needle. After the epidural space is accessed, a tiny, flexible catheter is threaded through and the needle is removed. Epidurals are a great way to be able to enjoy your birthing experience if you choose. There are many ways we can help you be comfortable during labor. The best thing you can do is to move. If you're in pain, do something. I say this so often. Sometimes you do not want to move because it hurts, but sometimes you have to move because it hurts. To help with labor pains, do cat-cows or stand up and lean forward with a flat back and rock. Sometimes the pain is caused by the baby being in a weird position. Position changes during labor can help encourage your baby to stay in the good positions. If stress levels are too high, labor will stall. So lower the lights, kick out the visitors, and breathe. Box breathing is a great tool that your support person can help you with. Focused breathing will center you and regulate your neurological system. It can help decrease the shaking and the nausea that you may experience in transition. Breathe in, 2, 3, 4, hold your breath. 2, 3, 4, exhale. 2, 3, 4, hold your breath. 2, 3, 4. At NTMC, we are very proud of our primary C-section rate. Our first-time C-section rate is less than 10% compared to nationwide rate of between 19 and 30%. We really work with our patients to have a vaginal birth. Despite best efforts, though, sometimes labor fails, and the doctor may recommend a C-section. Many times the reason is obvious at the time of delivery. Some babies have short umbilical cords that don't allow descent. Some babies have cords that are pinched off during contractions and the baby's heart rate falls too low to continue with a vaginal delivery. Some babies are just too big. If your labor ends in a C-section, plan to stay an extra day so we can help you with your pain. Breastfeeding might be the hardest thing you do. It takes consistent effort and determination. It takes commitment and practice. You and your baby are both learning something new. Allow time for you and your baby to navigate breastfeeding and take advantage of resources available to you. We have lactation-certified nurses as well as staff that are good at helping you get a good latch. Breastfeeding is the most beautiful time that you can spend with your baby. Knowing that you have not only grown an entire person, but you are providing everything that person needs for the first months of life is a powerful thing. There are so many benefits of breastfeeding for mother and baby. A few are listed here. Look over this and decide if this is for you. Benefits for mom are just as great as they are for the baby. Regular nursing causes the continued release of oxytocin, which stops uterine bleeding and shrinks the uterus. Long-term benefits include a decreased chance of breast cancer, ovarian cancer, obesity, high blood pressure, diabetes, and heart disease. The best part of breastfeeding is the beautiful bond that you will share with your baby. If you want more education on breastfeeding, many insurance companies provide online education and breastfeeding classes. Check your insurance provider to see if there's something available to you. There are also many good videos available on YouTube. There is no wrong answer when it comes to feeding your baby. If breastfeeding isn't for you, that's okay. Fed is best. Here are some fun facts about breastfeeding. A newborn's stomach is about the size of a thumbnail. It does not take much to make your baby full. Typically, there will be enough colostrum to keep the baby fed until your milk comes in. As your milk supply increases, the baby's need increases, and vice versa. If you choose to breastfeed, there is no need to use formula. Your body will produce what your baby needs. This is the end of the class. I hope we were able to address any questions you may have. If you would like a tour of our facility, please give us a call at 940-612-8400 to make arrangements. We will do our best to accommodate you. If you have any other questions, you may email our director at jamae.akins, that's JIMAE.EAKINS, at ntmconline.net. Thank you, and we look forward to helping you write your birth story.